This wasn't on the list for today, but I know it's hugely important, so I hope you don't mind my asking. What should people do about heartworm prevention?
It's crazy important. We just had, just to give you an idea, we just had 2 indoor cats that are heartworm positive. Never been out of the house, never been anywhere else but the house, and they're heartworm positive. Now, how does that happen? Welcome to Pause, Reflect, and Heal. I'm Dr. Randy. I'm here with my good friend, Mr. Mark Drucker, and we are going to do something a little different today. We've had a lot of questions that come across our website, our newsletter, and we're going to take this episode to answer those questions. We hope that we'll cover something that interests you. If you hear something that you like or you have more of a follow-up, get a hold of us through our website, drrandypetvet.com. Mark, how are you doing today?
I'm good, Randy. How are you doing today?
Good. It's a beautiful day in Tucson.
It's a beautiful day in Portland, Maine.
Okay.
Where I am. Yeah, and gorgeous. So I'm really glad we're doing this. I think it was a great idea, and kudos to you for suggesting it, because as you see a lot of the questions that come into the website and in through the newsletter, I also see them. And what I've noticed, which is not a surprise, is that there are some common themes.
Right.
So we've taken note of those themes, and those are the themes that we're going to go with today. And I hope, and as I'm sure you hope, I know that you hope, this will be a really helpful forum to answer some questions that are just common among pet parents. And we're going to cover some for dogs, and we're also going to cover some for cats as well. So not to worry on either front.
I'd like to add to what you're saying, Mark. A lot of people email me questions, and I do the best I can to follow up on as many of them as possible. But bringing them to a forum like this with you actually is going to be much more revealing, and I believe a much better way to get a lot of the numbers of questions answered. So I apologize if you've sent a Q&A and I haven't gotten right back to you. I do have a very busy day here at work most of the time here in Tucson, but I do the best I can. So I'm glad we're doing this also, Mark.
Yeah, so let's go and just get right into it. And I'm kind of loving our first question, because it's I've seen it come up several times, and it's a problem that I had with my first golden retriever, and that is, someone wrote in, my dog is incessantly licking his front right paw. The fur has actually come off and the skin underneath is showing. Can you tell me why he might be doing this? And do you have any suggestions of what I might do to correct the situation?
That's a great question. I want to say that none of these have been rehearsed for me, so I'm doing a lot of off-the-cuff things, and this is what I enjoy doing. So let's talk about that. So when a dog licks one paw, let's say, in this situation, we worry about something specific that's causing irritation, pain, nerve stimulation in that paw. Often we want to look at all through the webbing and the pads. Here in Arizona, we have a problem with cactus spines, goat's beards, which are a little foreign body that you can get. It's the bane of us bicyclists because it flats our tires very easily. But they can get stuck and sometimes even break off, and you can't really notice what's going on. So the first thing I would tell somebody to do is check that paw thoroughly, including pressing on all the pads, putting some pressure, because your dog or cat, if it's a cat, will indicate if there's a specific spot that's really causing them some issues. Now, I will tell you that there are multiple things that cause pain in a dog and cat that can cause them to lick their foot. So it's very strange. So a lot of times we'll go to that foot here on physical examination at PAWS Veterinary Center and not find anything. But we'll get to the elbow or the shoulder, and there's intense pain in one of those joints. These pains radiate. And so often the dog won't specifically be lame, let's say, or show specific pain in that joint but it will radiate down to the foot and cause problems. But obviously, this is something your veterinarian could pick up very easily on physical examination. So, a really good examination of the foot, maybe even, putting your dog, moving your dog's joints a little bit to see if you can pick something up. But from there, I would say a veterinary visit is probably well indicated.
Before we move on, I'm remembering back to when my dog had it.
Yeah.
And one of the things that they were considering doing, I never did it, was putting the dog on Prozac. Because
Really?
they thought that it might be some kind of OCD, maybe because I was at work during the day, even though
Sure.
I was taken out at lunchtime. But, I guess OCD, anxiety might be a possibility.
Yeah.
Or anything else, food sensitivity, allergies, or as you say, pain elsewhere.
Yeah. Well, you mentioned a number of things.
You sound like you haven't
there.
heard that before, right?
What's that?
You sound like you sounded a bit surprised when I said
Well,
that.
I'm not,
about
because the
Prozac.
dog was living with you, so I know that's part of the problem anyway. But
Right.
no, I'm just teasing.
Hey,
no, I mean,
Hank.
it's a very good suggestion, but let's identify some things that go with what you've said. Okay, is that Hank?
That's Hank.
Okay, so let's identify some of the things you've said. I mean, typically foot licking could be like nail biting in people. It can be a behavioral problem, and it can be part of an anxiety issue or whatever. It's not usually limited to one foot. Normally, it's multiple feet. Like they'll lick both their front feet, let's say, or both of their back feet. It doesn't have to be that way, but it could be. If you've identified, you've gone through this and there's been a really good physical examination. There's obviously no signs for referred pain, nothing local. Yeah, I mean, then behavioral stuff could be an issue. You had also mentioned there are a lot of things systemically that I always address too. Allergy is a huge one. But generally, foot licking with allergy is multiple feet. It's not usually one foot. That would be weird to see that happen, quite honestly. Now, allergies could have started the foot licking, and then the dog irritated that foot to the point where that's the one that they're focusing on. And then, obviously addressing the allergy, we've talked about this in multiple podcasts and Q&As, and we can address it some more down the road. Doing anti-anxiety type stuff would be a possibility. I wouldn't go right to fluoxetine or Prozac. I would go more to something like gabapentin, which is an anti-anxiety medicine that's very, very safe on their liver and kidney. But there are definitely ways to address that if we're thinking that's the area we're worried about.
Okay. What's interesting is we could spend a half hour on each question because there's
absolutely
so much to cover.
Yeah.
All right. So let's move on.
Okay.
Maybe I'll do another question about dogs, and then to be fair, we'll move over to the cat world. Okay.
Perfect.
So another question that comes up quite a bit, which I've also experienced, is what's the best way to treat hotspots?
Okay. Well, that's a really good question, and again, can be, really have multiple factors to talk about what could be causing it. So let's first describe what a hotspot is. So a hotspot is what we call a pyogranulomatous lesion. Very fancy medical term. It just means that it's red, irritated. Often they're infected and they're thickened because the animal's been, the dog has been licking at that area, scratching at that area incessantly. We want to make sure that we identify what this looks like and what it is. Now, I had a dog just last week that came in for a severe hotspot over its right shoulder. And when I examined the dog and we cleaned up the area, now the people had left this to scab over, which is a bad thing to do because there's no air getting to that skin. And when we got it cleaned up and clipped the hair around it, it was actually a tumor. It was actually a skin cancer. The people wouldn't have known this. And this is, again, where sometimes a veterinary exam is really important for these things. But there are multiple things that can get them started on these things. One of the things in your area that we'd worry about is flea allergy. Dog gets bit by fleas, starts to itch and scratch, gets one area started, and we're often running on this hotspot that could easily be a cause. Another thing could be allergies, and we just talked about this. Food allergies, environmental allergies, all of these things can cause our dogs to start to itch, and then again create one specific area where they've irritated or excoriated the skin that now gets infected sometimes. And again, we're often running on this chronic problem. We see, poor grooming. Like a lot of times animals aren't grooming themselves well, or they're not getting groomed, and the hair gets matted, just like I described with this animal with the scab, and there's no air getting to that skin. And that really can set them off because it's a perfect environment. It's dark, it's moist, perfect environment for them to develop a lesion at that area. And then, underlying skin infections. We do see staph infections. We see malassezia yeast infections. These are the typical, what we call doggy odor infections. Often I get people coming in, my dog smells so bad. I said, what's it smell like? Well, it smells like a dog. Actually, it really smells worse than that. It's a moist, damp, bad smell. And these are often underlying staph or malassezia infections, which again has a lot to do with a lot of other things that we address in all of our podcasts, things about biome and food allergy and environmental allergy. But specifically as far as the hotspot goes, it needs to be clipped and cleaned. It needs to be addressed with something local that's I try not to use oral antibiotics because I'm a real stickler about not messing up the dog's biome or GI tract by excessive use of antibiotics. So we'll use something locally where we'll clean it. Often I recommend 50-50, like Bragg's apple cider vinegar and water. There are commercial cleaners and wipes that work really well. I really like Pup Labs makes something called a soothing spray where you can spray on that area and it decreases the sensitivity. There's also a couple different calming gels and sprays that are made by a company called Duoxo. So these are the things we typically do. And the other thing is that a lot of times we have to keep the dog away from that area. I hate cones of shame. If we're going to use a cone for any reason, if the dog's really licking a hot spot, we'll use what's called a soft collar or a soft cone. But also what works really well is a t-shirt. So if it's a little Chihuahua, you go and get a preemie baby t-shirt at Walmart or Target, and you tie it midriff, and you got a great way to cover it because you're still getting air to that area. You don't want to try to bandage these things a lot of times because bandaging doesn't allow any air to get to it and it won't heal. But t-shirts work great. It's a big dog. You use a regular, boys t-shirt or men's t-shirt, and those work really well.
Okay. I've noticed, I want to move on, but I noticed when my dog used to get them, they grow, like they spread so quickly. Like you can almost see it spreading. It's so fast.
Yeah.
And it just looks so ugly and horrible,
Yeah. Yeah, and sometimes,
if we're wet looking.
Right. Oh, exactly. It's very moist, so that's why you want to clean it and dry it. And you don't want to use peroxide, and you don't want to use things like witch hazel, and because they are very drying. Like peroxide's great for the first time you clean it, but not again. And the reason why is peroxide kills new cells. It actually lyses the new cells that are forming to try to heal this. And so that will prevent it from healing. But we talked about like these Duoxo sprays or Pup Lab soothing spray and keeping it clean on twice a day basis with Bragg's apple cider vinegar, or even sometimes we'll use dilute Epsom salts and kind of soak that area. These are really, really helpful for the animal and can stop the spread and also stop the discomfort the animal's having. If it's an allergy, there are things like there's a monoclonal antibody called Cytopoint, which is given by injection, which is for allergy, that will stop the histamine production. We often can put them on minor antihistamines like Benadryl or diphenhydramine or something like Zyrtec if we really need to. But each case has to be assessed, and that's really a veterinary call at that point.
Okay. let's move over to cats.
Okay.
We get comments quite often about chronic renal failure.
Yes.
And what are the questions are less specific and more about, do you have ideas about it and how you might manage it or treat it?
Now you know that I have ideas about everything.
Right, you do.
So you're setting me up for this one, buddy.
So I want the big idea.
Okay, the big idea.
What's the big idea?
Yeah. Well, let's first talk about what renal failure is. We're talking about kidney disease in an older cat. Typically, doesn't have to be, but often it's in an older cat, and these are situations where the owner sees them maybe being listless, being not eating really well, starting to maybe have vomiting or diarrhea. Sometimes they will notice that they're actually seeing them show weight loss. And there are other things that can cause weight loss, but this is one of those things that definitely can cause it in that cat. Sometimes they'll notice, they'll go to the litter box and they'll see blood in the urine, or they're straining, or they're even drinking more water and then urinating even more often. These are the kinds of signs that can really be a situation where that cat really needs to be seen by a veterinarian as soon as possible. Because there are ways to treat this, and then there are ways to treat this. And so I'm going to tell you the Dr. Randy Pet Vet way, and then I'll leave the other ways available out there because there's lots of other medicines and prescription diets. And
so this is going to be the big idea.
This is the big idea. Yeah. So years ago, I got frustrated in the fact that what I was seeing was the direction of all of these big diet companies that made prescription diets was to formulate a low phosphorus, which is necessary in this situation, very low protein diet. Now, the thought was that in kidney failure or chronic renal disease or chronic kidney disease in cats, the protein in their food is being excreted in their urine, and it affects things called blood urea nitrogen. That's a protein byproduct that we measure chemistry-wise. Creatinine, which is the really big one, that's the main kidney enzyme. It's also a nitrogen breakdown product. Again, protein. SDMA, which is now something that we can identify early in cats and dogs that will show us that they're heading into a situation with potential kidney disease. But here's what happened, and this is what I saw. My cats would be on these prescription diets, and their numbers would get better, but they would start to waste away. They'd start to lose weight. And the question is, well, why does that happen? And you don't have to be a rocket scientist to understand this. What's happening in kidney disease is the kidney's not holding the protein that they're eating, and it's excreting a lot more protein in the urine. So what happens? If you feed a food that's low in protein, what ends up happening is they start stealing it from their muscle because they have to have the protein to support their body functions. So they look better for 3-6 months, maybe sometimes longer, but not usually. And then all of a sudden, they're losing more and more weight. They're getting more and more lethargic, and the numbers start to skyrocket again. So the prescription diets in my world was not the answer, okay? So the answer to me was, how can we get away with feeding these cats a high-quality, low-carb protein diet and still not affect their kidneys adversely? And the way I do that is actually using 3 supplements. So I go and I have my owners not use kibble type diets, preferably lightly cooked or fresh whole food or freeze-dried raw diets for our cats where they're getting plenty of protein, all of the carbs from the veggies that they need, but not getting excessive carbs, which are inflammatory and just going to create more inflammation in the body and in the kidney. And I add a product called Azodyl, A-Z-O-D-Y-L. It's a refrigerated probiotic that actually binds nitrogen from their diet so that the kidney can the cat can utilize the protein, but we're not getting excessive nitrogen loss. So the numbers, the BUN and the creatinine doesn't get affected. I also use a product called Naraquin, which is a phosphorus binder. It's really almost a natural product. Usually it's made from soft shell crabs and stuff like that. And it actually binds phosphorus so that, again, when phosphorus starts to rise in these cats, it causes irritation to the stomach. It causes ulceration. It causes hyperacidity. And these guys won't eat because they feel terrible. And then the last product I use is called Aminavast, Aminavast. And I use that because that increases blood flow to the kidney naturally. It's called GFR, glomerular filtration rate. And by increasing the blood flow naturally, the kidney can work a little bit more efficiently and handle what's going on. And in early kidney disease, okay, I can really get these cats to thrive. Not to lose weight, to feel much, much better, stop excreting all of the protein in their urine, not all of it, but a lot of it, and not having them affect the numbers that we look at, the BUN, the creatinine, and the phosphorus numbers that we really monitor. I just did this exact seminar for 1,000 Japanese veterinarians a year ago to talk about this because there really isn't anybody talking about this. They're talking about how they can get around some of the ideas on the diet, but no one's really got this. And I'll tell you honestly, for years, these cats have been benefiting. Where I would see them waste away at 3 to 6 months, I got a cat that's a year down the road, 2 years down the road, and still benefiting from what we're doing. Now, sometimes, and many times, the kidney's going to get worse, and it will happen, okay? Whether it happens at a year or it happens at 3 years, I don't know. I don't have any way of predicting. And then sometimes we will have to add some actual medication in there that can really help for that situation. But I try not to start it at that rate.
And is there an age where this typically occurs, or it's all over the place?
It's really more of a senior disease. I would say
it is. Cats
over 8 years old that start showing the signs that I mentioned earlier. That's when we really start to see it. But we do see, I've had a couple animals recently that have had problems with their kidney. We've actually done ultrasounds on their kidney to look at their kidneys, and we've seen renal cysts, or we've actually seen what's called renocortical hyperplasia, which we're basically getting abnormalities to the kidney. These are probably genetic in some nature. They could be caused by some toxin or some insult that they had that we don't know. But those animals are a little bit harder to deal with because they actually have structural disease that we've got to get on top of also.
Mm-hmm. Well, there's one more question that we have on today's list about cats, and you mentioned it earlier, just a few minutes ago, but it's about weight loss in general in senior cats. We see a lot of questions coming in about that. So I guess renal failure could be one of the reasons, but there could be many other,
yes.
I imagine.
Yeah, no, and I'm glad you bring this up because this is something that a lot of my pet owners, cat owners are the most incredible pet owners. I mean, we know why cat owners have cats. We just did that wonderful seminar about cats not too long ago, that podcast that we just did.
Uh-huh.
And I'll refer our listeners to that because it's full of information. But cat owners, many times, one, kind of look past some of the things they're seeing, and they just kind of, I want to say blow it off. They just kind of say, oh, it's really not a big deal. Jinx is really doing okay. I don't really need to go to the veterinarian. I don't really need to follow up on this problem. But weight loss is really a serious problem. So, and many times people don't pick it up until there's significant weight loss because, they're not weighing their cat on a regular basis, Some of my cat owners, I mean, I know you probably understand this about my pet owners down here. Some of them will get on the scale on a weekly basis with their cat, and weigh themselves with the cat and then weigh themselves, and they'll know what the cat's weight is, they'll extract. Or they even go to the extent of getting a baby scale and weighing them. But, every time a cat comes into Feline Focus here at Paws Veterinary Center, we weigh them. And there's a really good reason, because I've had cats come in for general physical examination at, let's say, 9 years old, and, they've been consistently 10, 10.1, 9.8 pounds, and here they are at 8.1 pounds. And that's a significant amount of weight loss. And the owner didn't even know. And so that I just want to basically mention that because it's something you really, as a cat owner, want to be aware of. So let's talk about the things that can cause that. Well, we just talked about chronic kidney disease or chronic renal failure. That's certainly one of them. Another thing that can happen is something called hyperthyroidism, which is caused by a nodule in their thyroid gland. And what it does is it causes their thyroid hormone to go very high, and it will cause their metabolism to go in overdrive. And they're burning up most of the normal calories and protein and all that they would get, so they don't incorporate that, so they lose weight. It also can cause sometimes hyperactivity, where they're really kind of active, much more active, even though they start to fail after a while. It can also cause them to eat more because they're trying to, gain those calories that they're losing, but they can't, and they can't tell, our pet owners, our pet parents, to increase my food because my thyroid is burning this all up. So that's where the biannual physical examination and lab work on senior cats is so important, because we look for trends. Again, thyroid could be, 2.1, 2.2, 1.9, and then all of a sudden it's, let's say not abnormal, but it's at 2.9 or 3. Well, that jump could indicate that it's starting to be a problem and we need to address that. So hyperthyroidism is definitely another one. Another one that can cause weight loss in cats is diabetes. Diabetes mellitus, is a really, dangerous disease. It can be acquired disease. And their blood sugars start to rise terribly, and they're not incorporating their normal amount of nutrition into their body. Often they'll be more lethargic. Again, they'll be drinking a lot more water, and those are some hallmarks. So there's some other things that we need to worry about, like dental disease. The cat's mouth could be killing them. We see cats with grade 4 out of 4 dental disease, and the owners don't even know it. But you open the mouth and it smells like trench mouth is what I describe it. It smells like a sewer. It's terrible. And they've got all of these hard calculus and plaque on their teeth, which is pushing up on their gums and retaining bacteria. Also, the number one reason why they get urinary tract infections, because that bacteria just gets sucked up into their blood system, goes right to their kidney and bladder, and we'll see the same bacteria in the mouth as we do in the bladder. So dental disease is another one. Another one could be heart or liver disease, and we see that causing an issue with our cats. Again, a diagnosis that's made by the routine lab work that we do. But the last one, which is interesting, is arthritis or pain. We know that 60% of our cats over the age of 8 have osteoarthritis. Yet many of our owners have no idea. Sometimes they catch the fact that the cat hasn't gone up on the bed recently or doesn't get into its cat tree normally. But on physical examination, we could pick this up and sometimes we'll confirm it with x-rays or radiographs. So all of those things, hyperthyroidism, chronic kidney disease, but then the last one that I'll mention, which is a new one on the horizon, is called small bowel lymphoma. So we are seeing this incredible rise of cancer in cats' small intestine. Lymphoma is a proliferation of white cells called lymphocytes that line the lining of the bowel, and it causes the bowel to swell and them not to absorb normally, so they're not getting their food, and it can often be indicated by vomiting or diarrhea, sometimes weight loss, but sometimes it's silent for a while, And all we see is that subtle weight loss that I talked about on that cat that we picked up on a physical examination. And there is a wonder. I used to have to do endoscopy on these cats, where I'd go in with an endoscope and biopsy their bowel and get the biopsy back and then have the diagnosis. Now, a company called VDI makes a laboratory test, a blood test, that we can actually test for lymphoma in our cats. It actually looks at lymphoma, pancreatitis, inflammatory bowel disease. So it really is very, very helpful on helping that diagnosis if the signs are there.
Okay, so let's talk, and maybe we can do a discussion here for a few minutes about dogs and cats. But let's talk about vaccines, because my understanding about vaccines, and this is a question that does come in a lot, and depending on the region they come in from, the region of the country, you get different kinds of questions. But I guess what I take from that is there are vaccines that are universal that your pet has to have, rabies, for example. But there are other vaccines that are lifestyle oriented. So if you're living out in the desert, you might get one set of vaccines. If you're living in a woodland setting in New England, it might be something different. I'm just thinking, for example, leptospirosis on the West Coast or in the western states, in the mountains, in the desert. And I'm thinking Lyme disease, for example, in the Northeast. So let's talk about that. And a question that I hear oftentimes is titer. So let's talk about vaccines. Let's talk about titer and how to address this in your pet.
Okay, good question. It's pretty encompassing. So I'll try to keep it concise. There are what we call the core vaccines for dogs and cats. Okay? Mm-hmm. So the core vaccine for dogs is distemper, parvovirus, and adenovirus. It's often called DAPL. I mean, there's a bunch of combinations. Lepto is added to that, but there's definitely some core vaccines. But distemper, adenovirus, and parvo are the core vaccines that we typically look at here in Tucson, Arizona, and many places in the United States. The other core vaccine is rabies. Rabies is a deadly disease in humans. It can be, deadly for our animals. It's out there, and we know it's out there, so it's an issue. Those are typically the big core vaccines. Here, we do a lot of something called upper respiratory or Bordetella vaccination. The reason that we do that is kennel cough is very, very big. We do have a lot of places where people board or do daycare, and we don't really want, or grooming, and we don't want that to spread. So that's often a vaccine that a lot of people ask about. And then you mentioned some of the subsidiary vaccines are things like leptospirosis, let's say, or Lyme's disease, or even some of the flu vaccines. And these are pretty specific for areas that you are in the country. And I would leave that up to your veterinarian to tell you what's most important. We do have leptospirosis in Tucson. We don't see it as often, but like in your situation, you're going to hike in the mountains with Hank. Leptospirosis is probably a really good idea because it's spread by, cattle basically being near water. The water gets infected. We also have it spread by a lot of avian species where there's bird droppings or rabbit pellets, and the animal gets exposed to that or water that has it, and it can be very, very damaging for the kidney. So those are the vaccines that most people talk about in dogs. Now, we are huge titer advocates here at Paws Veterinary Center, here at Canine CoLab, here at Feline Focus, where we have titers for cats too. We'll talk about, but a titer is basically a look at how protected your animal is to those vaccines. So years ago, we found Kansas State University. They had a wonderful laboratory that looks at titers, which is the measure of protection for distemper, adenovirus, parainfluenza, so parvovirus, and then also for rabies. So we started advocating in the dogs that have gone through their normal puppy series, that after the first year or so, let's not vaccinate them right off the bat. Let's look at their titer and make sure they're not already protected. Because like anything else, if the dog is protected for distemper, adenovirus, or parvo, why would you want to put a vaccine on top of that they don't really need? They're already showing protection in their body. The same thing goes for rabies. We often will advocate rabies titers. Now, this is controversial, and I will tell you that a lot of, like here in Pima County in Tucson, they won't license a dog with a titer. They will only license a dog if you've given them a vaccine, which is really strange, Mark, because here's the deal. If you go to Hawaii or England, which are rabies-free zones, they will not let your dog in without a titer. So they don't care how many vaccines Hank's gotten. They want to know that Hank is protected. And if Hank has a protective titer, he gets in. So why wouldn't we be in the situation where if we're licensing our animals, we utilize a titer and we can license them from that titer? The question lies, is it a money thing? I don't know. I'm not even going to get into that whole world. But we do titers here.
But if the dog has if they show up and they have titer, then there's no need to vaccinate.
Correct.
At that moment. But yeah, so is it like, okay, come back in a month, come back in 6 months, let's do this again, or they're good for another year?
Yeah, we do it a year.
A year. That's it.
Now,
okay. And I guess I have a...
Go ahead.
Go ahead, sorry. No, I have a question as a pet parent. I'm particularly concerned with Lyme disease. And so I had my dog vaccinated for Lyme, and it was two shots, a shot and then a booster, 3 weeks apart. And I guess the question I have is if the dog then gets bitten by a deer tick that's infected, is the dog protected now that he's had that vaccine, or is he still vulnerable, to being exposed and getting sick from it? I mean, how well are they
it's not 100%.
Question.
I mean, it definitely confers protection to them. I mean, there's no doubt about it. And in the Lyme's area, I would advocate looking at getting that done because, it's a bad disease and it's silent for a long time.
Right.
But I also advocate them being on tick preventative at that point too, because we want to try to keep them off. So even if a dog gets bit by a tick, the question is there still a percentage of dogs that might get Lyme's from that bite? And the answer is yes, it's possible. Now, much less if they've been vaccinated, but also much less if they're on a preventative, because what happens is as soon as the tick tries to attach to the dog, it will get some of the preventative and it will kill it or it'll drop off. Because the longer that the tick sucks on the blood, the more chance that it can inject the organism into their blood system.
Right. You know what? There are so many great questions, and I think what I'm sensing is we should do another one of these in a couple of months. A couple of months.
Let me mention the cat vaccines real quick, just because I think that's really important. So the core cat vaccines are definitely rabies again. Now, not always required in a lot of states. And then what we call feline herpes virus, feline calicivirus, and feline panleukopenia. And these are often upper respiratory type viruses. Again, the same thing goes for titers for those. We do titers on our cats. We often find for most of the cat's life, and sometimes forever, that they're protected and they don't need the follow-up vaccines after they've gone through the kitten series and maybe past the first year. So just to mention that, because we do that in cats all the time. And again, my goal is I just don't want to give vaccines to an animal that doesn't need it. And I don't want to have that immunological load on top of them if it's not necessary.
This wasn't on the list for today, but I know it's hugely important, so I hope you don't mind my asking. What should people do about heartworm prevention? It's
crazy important. We just to give you an idea, We've just had 2 indoor cats that are heartworm positive. Never been out of the house, never been anywhere else but the house, and they're heartworm positive. Now, how does that happen? So what people don't understand is heartworm is a disease that's spread by mosquitoes. A mosquito picks up an organism from an infected animal, whether it's a dog, whether it's a cat, whether it's a coyote, and they will have that organism in their system. And when they bite your animal, then they can inject that heartworm organism into the blood system, which then goes through a 6-month period of development and becomes these adult worms in the heart, hence heartworm. And so it's we used to think this was an East Coast disease, a Gulf of Mexico, or Gulf of America, I should say now, disease, water.
No comment.
But
no comment.
Right, but heartworm is everywhere. And it's very, we just had a dog that came in this week that we did routine blood work on. The people have not given heartworm preventative for 2 years because they didn't think it was necessary. They had really bad information from whoever they talked to before, and the dog came back positive for heartworm. And now is going to have to go through a very rigorous treatment to kill those adult worms. And if the adult worms are bad enough, they can cause clots and the dog can die even from the treatment, because we're killing those worms with medicine that we have to give the animal. So
there's been a lot of talk as well about all the rescues that are going on right now all over the country. And, heartworm is at least prevalent in the southern states, and a lot of these dogs come up from the south, and then they're taken up into the north. And so suddenly it's everywhere. Yep. That's one of the other things that are aiding this. And so I guess is the recommendation that if you have a dog, is it a cat thing too, heartworm disease? So if you have a pet, a dog or a cat, is it just regardless of where you live, you should treat the dog 12 months a year?
No, that's a good question. No.
What is the recommendation?
So the recommendation is they should be tested every year, no matter what. Because even on preventative, it's only 90 to 92% effective. Okay? So you still have the animals that have received heartworm preventative, let's say every month, and they're still going to come back positive. Now, it's obviously a very small percentage, but we make it part of our yearly examination. We make it part of the lab work, the blood work that we do to make sure that they're tested for heartworm. That's how this dog we were talking about just got picked up, because the dog hadn't had yearly lab work in 2 years, and boom, the dog's heartworm positive. The cats had never had yearly lab work, and that's how that was picked up. So the recommendation to start with is you test them every year. Now, when you receive a negative test, then the recommendation is preventative. Now, sometimes it's a little hard to advocate preventative for cats because they're really not a lot of exposure, but as I indicated, we just saw these 2 indoor cats. So, it's ideally the thing to do, but definitely for our dogs, preventative is really important. Now, you had mentioned yearly treatment versus intermittent. There are a lot of places where you get freezing where the mosquitoes are going to die. So those areas you could get away with not doing it yearly, but I just tell people just give it every month and then you got it down.
Right. What is this? Is it an herbicide, a pesticide? What is it?
I'm sorry?
Prevention. What is the prevention?
Prevention is basically, it's kind of like a very minor insecticide that doesn't cause a lot of issues in the body, but is there to specifically kill the worm when it encounters it.
Okay. All right.
Okay.
So we should, yes, that's great. I'm glad we could do a whole show on heartworm prevention for sure, and we may. Anything else that you want to talk about? Anything that comes to mind for you that you hear a lot about?
No, I think this is good. I think we should stop here, and we can do this again. I want to ask our listeners to make sure you subscribe to our newsletter. Get on to our podcasts on our website, subscribe to those because it really helps us. But send me your questions. Like I mentioned earlier, I can't always answer them individually every day, but I try to batch them and do things like this so we can get the answers out.
And if you go to drrandypetvet.com, there's both a form just to sign up very quickly for the newsletter, and there's another form there to ask a question. So you make it really easy.
Absolutely.
Right? Okay. Well,